To the latest in the fight against COVID-19, hospital beds continue to be scarce across southern Nevada as more people contract the virus and then become critically ill. Tonight, one cancer patient is speaking out. He says there was no room even for him.
I have metastatic melanoma right there, stage 3. I have a time bomb in my neck.
Professor Michael Kagan of UNLV's law school has stage 3 cancer.
The raised area, that's the cancer.
The cancerous lymph nodes are in his neck. August 4th, that was his surgery date at Mountain View Hospital to have his cancer removed.
Then they called me back the next day that the Mountain View Hospital couldn't take my appointment because they didn't have a bed to put me in after the operation. And that's because so many beds are taken up now because of people with COVID. I was depressed. I'm not alone, and I don't even think I'm in the worst shape. There are a lot of people who are having their procedures canceled.
Mountain View Hospital says to help with the flow of patients as our COVID-19 cases rise, we have enacted our surge plans, including the cancellation of elective procedures that would require an overnight stay. We are also caring for many patients who are arriving sicker after delaying care in previous months and who can't wait any longer. Different hospitals across southern Nevada are resorting to measures such as canceling elective procedures to make sure there is room for the critically ill. Plenty of people want to know, what exactly is an elective procedure? So it's a very broad medical term, and all it means, it's any procedure that can be delayed. It's not an emergency and can be done another day, but doesn't mean it's not important. So a lot of people think that it's just cosmetic surgery. So it is certainly that, but it's also procedures to help relieve pain and suffering, like, say, hernia procedures, back surgery, hip or knee replacements, and even as serious as cancer surgery.
I wouldn't have known this if I hadn't gone through it. They've told me, you need to have the surgery or the cancer will kill you.
Professor Kagan does have another date, next week at UMC. He's hoping there is a bed for him.
Please think of people like me. If we can keep people from getting hospitalized, which is what the vaccines do, then other people who are already sick, like myself, can get the treatment that we need also.
The Nevada Hospital Association says the vast majority, around 95% of COVID patients in the hospital, do not have a vaccine. So Professor Kagan is isolating at home. He's prepping for the surgery. He has to test negative for COVID-19 before he can be admitted.